Hi everybody, are you all worried about what are we talking about when we say PCOS? And this is something which is increasing in today's time. A 14-year-old kid comes who is increasing weight with abnormal hair, or you do have irregular cycles and acne, or it can come to a 35-40-year-old woman who is again suddenly started putting on weight with abnormal hair growth and again acne or irregular cycles. What is it which is increasing in today's time? Today's times, definitely due to pollution and the endocrine disrupting chemicals which are coming from the environment and the plastics which we are using in the sanitary napkins, PCOS is increasing. So what is PCOS? Is it a disease or a syndrome? Many people get confused. It is something which is not one particular disease. It's a syndrome definitely. Means it's a metabolic disorder. Means it is going to affect the future of a patient in the form of hypertension, diabetes, heart disease, and even cancers if it is not taken care of. So what do we mean by that? Are we here to scare you all? No. It's a lifestyle disorder where people start putting on weight. It will not come down because there is insulin resistance which is increased. So first thing, insulin resistance is increased. Second thing, there is hyperandrogenism which leads to acne and a lot of abnormal hair production. Third, what is happening is a central hormonal imbalance where the ovulation does not happen. And because ovulation does not happen, infertility becomes an issue. And because it does not happen, irregular cycles become an issue, and it will be a withdrawal after 3 months, 4 months. And when it starts bleeding, it's going to happen a continuous bleeding. And if PCOS is not kept under control, it can lead to, like I said, diabetics. If they're not already diabetes or de novo diabetes is not detected, they can develop diabetes. Obesity is something, again they can go to endometrial cancers, hypertension and hyperlipidemia and heart attacks also. So what do we do? So whenever these kids or women come to us, make them understand how it is a lifestyle disorder. Any lifestyle disorder, the treatment is like 50% from the patient, 50% from us doctors. So what am I going to tell you first? The first 50% is always from you. So the first point, do regular exercises. You might as well say that I am doing regular exercise. I go for walking. I go for yoga. No. This is not what we are looking at. We are looking at insulin resistance. Each muscle of you will have a insulin receptor. That has to be under control. So what are we doing? You should be regularly exercising so that every muscle contracts. So it can be in the form of aerobics, cycling, swimming, and it can be even dancing. That sort of exercise is what we are looking at, or gymming. We are not looking at yoga, we are not looking at walking. They both are good for circulation and other type of flexibility. Definitely not for PCOS. So insulin resistance has to come down. The first step is regular exercises where every muscle contract. The second step is to change of diet. What do I mean by change of diet? So girls out there, anything whatever you want to eat, take in the plate. Please decrease your carbohydrates and increase your proteins. So whatever you're eating, it has to be, the ratio has to be less carbohydrate and increase proteins. That is what you should look at. And the total kilocalories also should be decreased to a lesser amount. Means if it is 1800 kilocalories, which we usually tell a girl to take, it can come down to 1200 or 1400 depending on the initial weight. So we are just looking at 10% decrease in your weight. That these two things should be done, and de-stressing is something which has to happen. And things have to have parallelly. Your work should be parallel and my work should be parallel. So whatever abnormal hair, so we now spoke about insulin resistance, how it can come down. The second point I told you is hyperandrogenism. How can it come down? So whatever abnormal hair which has already come, you need to go to a dermatologist and get rid of it using laser. But checking the testosterone, free testosterone levels, and seeing that testosterone levels come under control is my work, where I'll put in a medicine to get it under control. The last but not the least is the central hormones which go awry in PCOS. So for that, then we look at the age of the patient and the need of the patient. If the patient is an adolescent, younger girl, we put them on medicine which keep the central hormones under control. The people are usually worried, how long should they take the medicine? We review the patient every 6 months, review the hormonal levels every 6 months, and continue the medicines accordingly. These medicines can be taken for 5 years, 6 years till the girl is married and thinking of pregnancy. Why is it so? PCOS, if not treated, is more dangerous. Not the medicines. the disease is dangerous. Please understand that point. So what is important is when we give the medicines, you have to listen to the doctor and take it regularly, repeat the hormonal levels every 6 months and see whether it is coming under control or not. So tackling the three-pronged approach of looking at the central hormones, insulin resistance and the testosterone is the way to go forward. Scan will always show PCOS. Please never go and jump and keep doing scanning. That is not a solution for it. So girls out there, there's nothing to be worried about. PCOS is a very common disease and definitely it is a lifestyle disorder. So keep your lifestyle under control. Don't get worried. Keep the disease under control. And when you want to become pregnant, you might need a little hormonal treatment for induction of ovulation. So meet your doctor and to talk to them about it. All the best.